And what is microinsurance? Somehow we want to have insurance, inclusive insurance. It means that we want people to be insured together and to have access to some risk management or risk mitigation mechanism. And at the end of the day, we want to know how much it costs. And it's true that when you buy a product and you send the money somewhere to some HO of some company in Berlin, Mumbai, or wherever, and how much has gone back on the field, is it of your interest? Is it important or not important when you have taken the moral responsibility to help a group of people to be insured under a given scheme? And again, what is the goal about it? Is it to insure people or to get them on a better health? Is the health properly served to this group of people? So all this is touching obviously to pricing, because pricing is nothing else than bringing a service for a given objective. It's like a Vichy with a trigger which is more based on some ailment trigger. So the whole issue is about that. And what we have to deliver, coming back at this session objectives, that we have only 35 minutes left. And we need to deliver practices about data in this industry. Because we have a mandate of inclusive insurance, and at the end of the day, what we would love is that we see the beauty of a demand-driven kind of mechanism. So we see the beauty of insurance, and that's why we are all here talking about the demand-driven mechanism in order to serve proper health people. So it's, at the end of the day, a lot about data sharing as well in order to know if we deliver properly, isn't it? I mean, is the pitch okay?
Yeah. About a slight contribution for the kind of pricing, like whenever we are doing, especially when it comes to the health insurance pricing, it's a bit more complicated compared to the other general insurance on that. One is that we don't have a kind of a data for the any clear data for the health insurance.
I'm sorry, clear what?
Clear data. The data for the health insurance.
Historical
to get the kind of assumptions on that. And anyway, with my experience, like 12 years ago, when we were doing kind of a health insurance in the world, the thing, we have to keep a lot of assumptions to be in place in order to do that one. We don't have a clear data on that. Okay. Health insurance sits on where there is an existing clear arrangement of health service providers are available in the market. And if you don't have that, any health insurance product you place it on top of it, it could be quite shaky. The cost of health service providers varied like anything. Like for example, from $10 to $500. Like it's a huge spectrum of what you're talking about. So before doing that, we did a kind of a categorization of the hospitals. Like for example, A category, B category, C category.
So you say that we need to standardize the healthcare in the country. So
not standardize, not standard. I can't standardize it because it's the work of the Ministry of Health's job to standardize it. But I cannot really go. When you go to a hardware shop, when I go and ask the cost of a nail and a nut and screw and a bolt, he has a right to sell it for his own cost. The neighbor can sell it for 10 rupees, the other guy can sell it for 2 rupees. But I would put in a category of a A and a D category. Then when it comes to the affordability, somebody talks about the affordability of what a client would really place into it. So for example, you give them A, B, C category, and the population pyramid you talk about that A, B, C category, and try to fit into that kind of a segment what exactly can be available for such a set premium cost to what health facilities you can allow that on. Keep some assumptions on that, like for example, what inclusion, what exclusion, what it covers. Certain guidelines like a national average cost of malaria, average cost of like respiratory tract infections and typhoid, and that kind of things can be taken into consideration. Waiting period, again we talk about preventive health component. Those are the kind of consideration that one has to keep in mind before you work out on the pricing. I'm talking about an experience of you don't have anything on the table. You try to design a health insurance program from the start, even health insurance. There are lots of challenges in order to bring up on board. Keep that kind of an assumption in order to come to pricing.
So to Francois, at your point, what is said about
and any business in this world is based on information asymmetry. If I know something that you don't know, I'll be the best one to sell it to you.
I've not seen one actually giving a concrete guidelines on setting up a health insurance program with my experience. Not even one actually giving me a concrete. This is the assumption. This can be done. Only they are also very vague in terms of numbering, playing with the numbers.
Still, this is a good question. Okay? It's good to have knowledge. I'm not saying it's good to have actuaries. After the way you manage knowledge and the way you get into standard is another issue. But definitely, there are many things that one can assess, and the whole idea about coming back to this suggestion that I'll take from Francis, we talk about this market, and just I would like to make sure that we agree, because at the end, as I said, we have to deliver something and some recommendation that we push forward together, right? So when we have a suggestion like this, does it make a difference to you if you know what is the average cost of curing typhoid?